When you're coming in for a scan, it often depends on the local protocols as to what you do or don't need to take off, but you don't necessarily need to be in a hospital gown. For most of the nuclear medicine scans, there will be a period after injection, what we call the uptake phase, and that can be something around 60 minutes or a bit longer if you're having a bone scan. And then you will be asked to lie in the scanner and you'll have your images taken. The images themselves will probably take up to about half an hour. You may be asked to get off the scanner and go to the toilet and then go back on so we can get another scan of the pelvis. But generally you should be in and out of the hospital within a couple of hours. You won't feel much different, but you will need to be careful around your friends and your family, and particularly people who live in the same house as you. So some of the radiation restrictions may involve avoiding prolonged close contact with those that you're going to see on a regular basis, but you can be in the same house, you don't need to lock yourself away in a shed, you can still go to work, etc. if that's relevant, but all of those things should be discussed with your team at the time. Most patients, we expect to give them 4 or 6 cycles of treatment with an interval of around 6 weeks between each cycle. But that's reviewed on a cycle by cycle basis, and we keep an eye on blood tests, how the patient's feeling, and also what the scans are showing in between cycles to know when to scan, when to treat, and when to proceed.